Hey guys, it is really fucking early in the morning. It's almost 5 a.m. It's like 10 to, I think. And, I'm vlogging this late because I just got back from the hospital. Again. Okay, but I'll go into that in a few minutes. Anyway, so in first period today, we were going over, AED, or CPR using an AED, and we're supposed to be tested over it tomorrow. So if actually the fact no, I won't be. Okay, no, because it's 5 in the fucking morning and mom already said I'm not going to school tomorrow because I've been up for almost 24 hours. Anyway, that's pretty much what we did the majority of it. Other than that, I cleaned up my bruise. I was at the hospital by my high school, yesterday to see what's wrong with my upper respiratory, and they couldn't get my blood, but they gave me a bruise. Yeah, they poked me 4 times to get my blood. Twice in this arm, and twice in this arm. But only my right arm bruised, which is kind of weird, but I've also only ever had blood drawn from that arm maybe once. Normally it gets drawn from my left. But anyway, so that's pretty much what we did, and then, like I said, I was cleaning that up. I had some, alcohol wipes, and I was wiping all the stuff off, because what they had on my arm was like putting glue on it, and it left this really sticky residue, and when I put on my pullover this morning, I just ended up with this giant glob of really dark gray, anywhere where I had a Band-Aid. Anyway, then in second period, we were going over the study guide and the vocabulary for a test we're supposed to have tomorrow. That I can make up Friday, no problem. Anyway, so, yeah. Third period, I was finishing a test. Fourth period, I was pretty much just talking to Mr. Camp and, doing some stuff with chemicals. I was cleaning it out and so on and so forth. And then in fifth period, we had a test over the crucible, which isn't bad. I got stuck on a couple of them, but that's about it. And oh crap. I'm gonna see if she can reopen that for me. We had an assignment online, and it was due by midnight tonight. And pretty much as soon as I got home, I ate dinner, mom came home, we got whatever we needed to do done. Because I went home alone. Because Grace drove today, so she took Emma home, and she was able to take herself home, obviously. But, anyway, pretty much end of the day, came home, ate dinner, texted mom, she was coming home because she had a doctor appointment earlier. And Gigi was leaving because she was going to a dinner at the church, not our church, but like the community church. And, mom and I had been talking about, like, we want to get a second opinion about whatever the hell's wrong with me. Or about whatever the heck is wrong with me, because obviously being told I'm not dying. Gee, thanks, but can you please tell me what is wrong with me? No. They did the very basic, saying whether you're dying or not, which is what that hospital's always done. I mean, I've been diagnosed with pink eye at the doctor, told to go to the hospital to get, like, a culture done, and then the hospital saying, yo, you don't have pink eye, when my eye is super pink and, like, bloodshot, and I'm crying because it hurts so bad. And they're like, oh, no, you're fine, honey. Really? I'm fine. Thank you for telling a 7-year-old who was just told by her doctor that I have pink eye, and then you telling me I don't have pink eye. They're very stupid. They've actually successfully diagnosed me once when I was 5 because it was the first time I'd ever had pneumonia, and it was the worst time because they were draining fluid from my lungs, so I'm pretty sure my mother could have actually diagnosed it, but obviously she can't drain fluid from my lungs. Anyway, so like I said, got home, ate dinner, mom came home, we got all our stuff set up, because after a scare at the first hospital saying, you may have a blood clot in your lung, oh, shit, I got my stuff ready. I was prepared to have to stay if I needed to. I had my schoolwork, I had my jeans, I had honey, I had my bottle of water, I was wearing pajamas. Like, I was not about to go uncomfortable, which is why I wore my pajamas. It's also why I'm still in this shirt. Because I tend to sleep in the shirt that I'm gonna wear the next day. So, like, when I did yesterday's vlog, I was wearing this shirt. Well, it's 5 a.m. and I haven't gotten any sleep except for maybe an hour at the hospital. So, yeah. Anyway, like, I was ready. Like, I had my medicine. I had everything I could have needed, if I had to stay. But got there, as soon as you walk in, they ask, this was East Tennessee Children's Hospital, in Knoxville. I actually have to go there for endocrinology appointments, so that's not abnormal for me. Because we know where it is, we know where the parking garage is, we have doctors there that we are very comfortable with. But, anyway, so we got there, they take your blood pressure, they take your pulse oxygen, they take your temperature, and, they do one other thing that they listen to you. So, like, if you're complaining of chest pain like I was, they listened to my breathing to make sure I wasn't, like, wheezing really bad. They couldn't hear rattling. They couldn't hear gurgling, to make sure that I was okay enough to be able to wait a little bit rather than having to go in emergent, which would be a lot faster. Anyway, sat down. Then you get called back to triage, which they take all of your vitals again. They weigh you, they do your blood pressure, they do everything. Then you go back out and sit back down, and then you go to registration, and then you go sit back down, and then I went back and had to have an EKG done, which I've never had done before, so it was really weird, but it wasn't bad. And then after the EKG, I went and sat down, and they said they'll be out in a few minutes to get you a room, because they were really busy. They had probably 50 kids in there. And most of them were under the age of 5, so it's like, I'm a 17-year-old female who's just having a bit of difficulty breathing, like, it hurts my chest. However, there are babies in there that look like they're gonna be dying, so, obviously they need to go before me, like, yeah. Which most of them did. Anyway, so then I went and got a room. They hooked me up to an EKG and a pulse oximeter, and a blood pressure cuff, and they took my temperature again. And they said, wait here, the nurse will be in a minute to get whatever. So the nurse got blood and a lot of other things, like, not a bunch, but it's just like, okay, how are your symptoms on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've had in your life, what is it? I was about a 6, I've been about a 6 or a 7, pretty much the entire time I've been sick in 3 weeks, but, he ended up taking blood a little bit later when I had to go to the bathroom. They needed a urine sample, and then, they said, when they had taken their blood, they were sending it off for several tests. They did some, rapid tests for strep and mono, and they did a flu test, and, several things. They tested for probably 3 or 4 things. But they did blood. They tested my thyroid because at the first hospital they got a really high reading of like 6. And then at this one they actually ended up getting a normal reading, but we didn't know that until 3 in the morning because we didn't get discharged until like 3:15. But anyway, so other than that, my vitals were really, really weird for a while. Like, my normal heart rhythm is about 73 beats per minute. That's my normal heart rate. Obviously, if I can talk, pulse oximeter, you want it about 98 to 100 in that area. And then for breathing, my normal respiratory rate is 13 to 15 breaths per minute. And even for the average adult, it's 12 to 20. That's normal. That is completely, like, textbook normal. However, at one point, it had me at 46. Like, holy crap. That's really high. Now, I was eating a gummy bear, but still, it soared really high. So did my heart rate. My heart rate was, very arrhythmic. At some points it was at like 110, at others it was in its normal range of like 72, 73. Like, it was anywhere in there at any given time tonight. But, they had said, there are a couple things that may have been wrong. This was before they, gave me, medicine. They said you may have swelling in your lungs, which can cause the chest pain, or, you may be having, like, asthma-type symptoms. And I don't have asthma, so, yeah, but I'll get to that in a minute. They said, we're gonna give you an ibuprofen, and then, depending upon how that works, if it doesn't, we'll give you albuterol. Well, I took an ibuprofen, and it didn't help at all. I think it may have gone from a 6 to a 5, but it wasn't anything significant, because it still hurt pretty badly. But, then they gave me, a little bit later, like an hour later, they gave me albuterol via a, thingy. Via an inhaler. They gave me 6 puffs of albuterol, and, that helped almost instantaneously. It dropped from like a 6 to a 2, which is really good in 20 minutes. Like, it was really nice. And, they kept waiting for the blood test to get back, like, forever. And then they did another swab test. And then, yeah. Final verdict was I have, reactive airway disease, meaning that I will have, asthma-type symptoms, like I will be wheezing, or I will have really tight, chest pains. Not like a heart attack, but it's like it'll hurt to breathe, or in my case from the other day, it hurt to swallow. It felt like all the liquid was going into my lungs, but, they prescribed me, an inhaler of albuterol, and that was good. That was very good. But then, yeah, they gave me a steroid, just one. It was a liquid steroid. It tasted like cherry. And then the nurse, Brandon, he was very attentive. Like, he was in there probably every 15, 20 minutes saying, "You okay? Do you need anything?" It's like, no, I'm okay. I don't need anything. At one point, I did ask for a blanket because it got very, very cold, or I got very, very cold. But, yeah. Anyway, long story short, Mom said from now on, you're going to Children's Hospital because, 1, we have doctors there that we trust, and 2, they'll do anything they can to find out what could be causing it. Because, no, this is not uncommon in any sense. It's actually, a group of several things. Like, if you have asthma, or you have COPD, or if you're very prone to upper respiratory infections, you can have this. I mean, I've had pneumonia 7 times, I've had bronchitis